Hello, this is James Lowry at James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering with immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is, what immune disorders cause hives? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. What immune disorders cause hives? Now, immune disorders of this type being ones that cause itchy red raised welts that last longer than 6 weeks are diseases such as Hashimoto's, Graves, lupus, rheumatoid arthritis, and celiac disease, to name a few. Diseases of this type are often linked to an overactivity of the immune system, or rather a form of dysregulation where antibodies mistakenly target and attack healthy skin cells and white blood cells. At the core of many, if not all, immune disorders is some type of dysregulation between one's neurology and one's nervous and immune systems. And it usually involves a combination of all three. Now, is there a form of treatment out there that deals with the dysregulation between one's neurology and one's nervous and immune systems? There is. It is a branch of science known as psychoneuroimmunology, which studies just that, the interaction between one's neurology and one's nervous and immune systems. At the core of psychoneuroimmunology and its applications in the form of mind-body therapies, such as hypnotherapy, is looking at where attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind-body therapies such as hypnotherapy aim to therapeutically affect the tension in this way in order to help people reestablish a healthy communication between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't help. How is this different? Well, most therapies aim to alter or bolster your conscious perception of the problem. But if you could consciously decide not to have the discomfort you are experiencing right now, it would only be reasonable to assume that you would consciously do so. Would you not? If you could have consciously decided not to have taken on the problem, the pain, the discomfort at all, again, it would only be fair to assume that you would consciously have decided to do so by now. So the problem, the discomfort, and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious part of the mind. So if you're looking to adopt this kind of therapy, one that addresses the unconscious mind in a way that helps you relieve the emotional stress surrounding your discomfort in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.